Okay, guys. So one of the doctors has asked me. See, I think she. So the doctor said, "Sir, I just want to check the topic regarding somatic symptoms, OCDs, and their associated disorders." I think I we explained about OCDs, obsessive compulsion disorder. I already said I explained OCD. You just check my channel. I think I already dropped a video regarding OCD and treatment. And dissociative disorders, that also I will explain, you just check it. But somatic symptoms and some sort of disorders we will explain today. Somatic symptoms. One of the doctor have asked me, "Sir, please explain this topic. We just want to revise it. I already read it, but we just want to revise." Fine. See, first, one of the most important definition that you should read first before getting into this is alexithymia, right? Is something called alexithymia, right? Right? What is meant by alexithymia? It is the inability of a person to label his own emotions, right? That is called alexithymia, right? It is the inability of the person to label his own emotions. Means he cannot define his own emotions. You make it happiness, you make it sad, anything. Alexithymia is the inability, it's the incapacity of a person, inefficiency of a person to define his own emotions. He cannot label it or define it. Now, so the patients, they have some defense mechanisms when they are in stress. So what are those mechanisms? First one is somatization. Second one is something called dissociation. And third one is something called conversion. Okay. Now these three are the defense mechanism. Generally the patients who are in stress, they exhibit with these three defense mechanisms: somatization, dissociation, and conversion. Now if someone asks you what are the disorders that are related with these things, with these three mechanisms, the first one is something called somatic symptom disorder. Okay, according to DSM, but according to ICD, bodily stress disorder regarding ICD, right? Now it can also be called as somatoform or somatization disorder. See, listen, this also known as words. Why? Because most of the times these names will come in the exam. You might get confused to see what it is, and mainly this one I will write it in red color. It is also called Briquet syndrome. Remember this, it's called Briquet syndrome. Somatization or somatic symptom disorder or somatoform disorder are also called bodily stress disorder, are also called Briquet syndrome. Now what is the duration of this disorder? The duration is something like greater than 6 months. Now what is the predisposing factor? If you ask, it is simply many stressors. The person suffered with many stress related factors, many stressors. But what is the presentation? How the patient presents to you? the patient generally has multiple complaints. The patient generally has multiple complaints. Example, this normally come with a complaint of body pains, headache, etc. And they also define like there is a multi-system involvement. For example, there is involvement of CVS, CNS, GIT, renal, etc. So there is a complaint of multi-system involvement. Different complaints they will say. And they also define it for multiple investigations. They undergo for multiple investigations. And one more important thing, this might be in your question, the patient will have multiple consultations. He will be consulting lots and lots of doctors unnecessarily. He will go to different doctors. So the patient present you with multiple consultations. He goes to different doctors. He consults different doctors unnecessarily. Right? Now, what will you do to this person? Tell me. Simple. It's very simple. The only thing you can do to this person is, the treatment is reattribution therapy. Simply reattribute him. Reattribution therapy. Simply just give him a positive vibe. That will be sufficient. Reattribution therapy. But if you want to give some drugs, some pharmacotherapy, you can simply go for antidepressants. Also, you can add some anxiolytics for it. So this is the treatment for somatoform or somatosization or somatic symptom or bodily stress disorder, or also called Briquet syndrome. Right? Now, if we come to the next disorder, that is something called factitious disorder. And in this thing, or Dr. Shoppers. See, the name appears funny, but still they have a deep meaning with it. Right? The name sometimes appears funny, but still they have some deep meaning in it. That is the fancy of medicine. Okay. So what is meant by factitious disorders? What do people do? What these patients do is they deliberately, means wantingly, knowingly, they create some symptoms. They knowingly create some symptoms for no reason. Actually, there will be no any sort of active reason, but simply they create these symptoms for no reason, not even for secondary gain also. Secondary gain means if they are wanting any attention from the family, if they want any leaves from the office, so there will be no secondary gain also. So just for no reason, they simply blindly create some symptoms in the patient themselves. Now, what is one more thing that you see in them is pseudologica fantastica. Means they say number of lies. Not even one, two. They say number of lies, which is called pseudologica fantastica. It can be defined as pseudologica fantastica. And they also travel long distances. They just simply move from one place to another place in a long distances simply for one reason, that is medical attention. So this condition of traveling long distances for medical attention is called peregrination. peregrination, right? Now they have multiple scars. They present with multiple scars on abdomen due to multiple surgeries. I really surprised whether these type of patients will be there or not. I really get a doubt, right? So they are presenting with multiple scars on the substance due to multiple scars on the abdomen due to multiple surgeries, which is called grid abdomen. You might get a question on this name. Grid abdomen is seen in a patient suffering with, remember, grid abdomen is seen in the patient suffering with factitious disorder. Okay. Now one more important definition is Munchausen syndrome or factitious disorder by proxy. What is meant by this? What is meant by Munchausen syndrome or factitious disorder by proxy? I will explain this. It's very much simple to understand. An adult just bring his child. An adult brings his child or a dependent person. Dependent person on whom? Dependent person on the patient. You understand? I think you understand this statement. An adult simply brings his child. Who is this adult? This adult is the patient itself. This adult will bring his child, bring his or her child, or he might also bring a dependent person. He may bring a dependent person. Dependent person means who is completely depend on this adult, or so called he is the patient. This adult is the patient. Okay. So what happens is, in this condition, the patient or the adult brings his child with symptoms, right? Or there is a conscious production of symptoms for secondary gain. So here there is a secondary gain, but in where? But here there is no secondary gain. In normal factitious disorder, there will not be any secondary gain. But if it is in case of Munchausen syndrome, there is a secondary gain. Right? There is a secondary gain. Now this is called, this production of symptoms for secondary gain. Production of symptoms for secondary gain is called malingering. Very important. Very, very important. Malingering. Malingering is conscious production of symptoms for secondary gain, like something called leave compensation for leave. Okay, that is called this. Now one more disorder is illness anxiety disorder, are also called hypochondriasis. Now I will explain what a hypochondriasis means in the previous topics. You just please go and read. Is nothing but medical student syndrome. That means the medical students most often they get fear of that they might have got this cancer, or they might have got TB, or they just fear for it, but actually they don't have any condition. They just simply fear that they might have got those type of conditions, right? So that is called hypochondriasis. Now one more thing is body dysmorphic disorder. This one I should explain. Body dysmorphic disorder. Dysmorphic disorder. Now what is body dysmorphic disorder, or you can also call it as dysmorphobia. dysmorphophobia. What happens is the patient just imagines some fixed body shape in his mind. So he just simply compares himself with that, and on and always he think like he is not up to that shape. So what happens is his mind is preoccupied with a body shape and size. So I think you got my statement. You understand or not? Or I will tell in a simple way. For example, let me take me as an example. Okay, for example, I have Hrithik Roshan in my mind. Always I have Hrithik Roshan in my mind. So I always look into the mirror and I simply say like, maybe my body is not up to the mark, maybe I am not having good chest, maybe I am not having good biceps, I am not as fair as like the reflection I imagine in my mind, maybe I am not having good color, I am not white, I don't have long hair. So on and always I always compare myself with a preoccupied or an image which is already on and always present in your mind. So you always compare with that preoccupied image with a particular body shape and size and color. That is called body dysmorphic disorder. Okay, I think this is okay for this topic. Okay, we'll meet in the next topic. Thank you.